Well, hi, my name is Peter Chalmers, and this is our video on the University of Utah Shoulder and Elbow Surgery Fellowship. And I'm just delighted to be joined by my partners, Dr. Robert Tashin and Christopher Joyce. And we're hopeful that this video will provide you with more information about the fellowship so that you can learn more about it and understand whether it's something you might be interested in pursuing in the future. So, as I mentioned, I'm Peter Chalmers. I've been here at the University of Utah for 7 years. And before that, I was at Washington University in St. Louis for fellowship, and then before that, I was at Rush in Chicago for residency, and I've been really happy here at Utah. It's been a great place to be in practice, and I'm really excited that we're starting this fellowship. I think it's going to be a great opportunity for people to learn how to do shoulder and elbow surgery, and then in addition, I think that it's going to be a great opportunity for us to show you all the great things that we have going on here. So, Bob, maybe you can tell us a little bit about yourself.
Yeah, thanks, Peter. So my name's Bob Tashin. I've been here since 2006, so a little over 17 years. And I did my residency out at Brown in Providence, Rhode Island, and then I did my fellowship out at Washington University in St. Louis, and have been out here now over the past 18 years, and look forward to having any new applicants come in to be able to work with us to do shoulder and elbow surgery. Chris?
I'm Chris Joyce, also shoulder and elbow trained surgeon. I've been here about 10 months now, so I'm the newest member of the group. Very excited to be out here. I did my training residency was at University of Colorado, and then I did my shoulder and elbow fellowship at Rothman Institute in Philadelphia. Yeah, excited to have you guys.
Okay. Now, we'll just briefly go over a little bit with regards to why we decided to start the fellowship. Peter and I have been working together here for about 6 or 7 years, and we've been training residents and fellows from the sports medicine division as well, and then made a decision that we wanted to have an opportunity to train people that were going to do the same things that we're doing for the rest of their lives, and give them an opportunity to not only learn what we have, what we were taught and trained to do, but also to be able to prepare them to become academic shoulder and elbow surgeons. And so to give them all the tools to be able to clinically treat the various pathologies that we treat in shoulder and elbow surgery, as well as give them an opportunity to learn how to do research and produce in a high quality fashion both basic and clinical research, and then also give them an opportunity to learn how to educate. And so the combination of education, research, and clinical practice was the reason why we felt we wanted to start a fellowship program here, and look forward to being able to provide that for you if you decide to come and join us. In terms of our mission or purpose with regards to the fellowship, it is really focused on those 3 key tenets. It's research, education, and clinical work. And we feel that the combination of having now 3 shoulder surgeons here, that would be able to provide an excellent opportunity for you.
Well, I should tell you a little bit about what we're doing here clinically at the University of Utah. So the University of Utah is situated in Salt Lake City, and the thing that makes it unique is that the surrounding area, there are no other academic medical centers. So there are no academic medical centers in Idaho, Montana, Wyoming, much of eastern Nevada, western Colorado, northern Arizona. So there's literally a 10% in terms of geography portion of the United States that refers here to the University of Utah. So the thing that makes that great from our perspective is there's a lot of referral cases. So from an arthroplasty perspective, there's a high volume of revision arthroplasty. There's a high volume of cases with abnormal pathology or unusual morphology. For me at the Children's Hospital, there's a lot of patients referred in with unusual deformities or unusual pathologies. And that makes this a great training ground for fellows, because if you come here, you'll see the full variety of things we do. Now, in addition to that, we're doing a high volume of the more bread and butter kinds of things for Salt Lake, which is a rapidly growing metropolitan area for which the university provides roughly half of the care for that area. And so for that reason, we're kind of high volume in a wide spectrum of things and cover a wide variety of places. The university covers not just our main University of Utah hospital, which is a tertiary referral hospital that contains all of the highest level tertiary referral things you might need. But we also cover the Orthopaedics Center, which we're sitting in right now, which is essentially an orthopedics only freestanding hospital that has both kind of an ambulatory surgery center feel, but also several inpatient beds in our clinical space and our research space. We also cover several outlying satellite centers like the Farmington Health Center and the South Jordan Health Center. We also cover the VA, which gives us access to the population of veterans, which has their own unique pathologies. And then I also go to Primary Children's Hospital, which is, again, the only children's hospital in this region, to cover pediatric shoulder and elbow problems. We're also hoping then to give you each a little flavor of what we do individually because our practices are slightly different. I've given you a flavor of mine. I go to the Children's Hospital. I have a higher volume of sports within my practice, but also do a high volume of primary and revision shoulder arthroplasty and rotator cuff repair and all the other things we frequently do. Chris, you want to tell us about what you're doing?
Yeah, definitely. I'm a little bit newer here, so I'm still building my practice, but my practice is a little bit heavier in the shoulder arthroplasty. About 40 to 50% of my practice is shoulder arthroplasty related. But again, I still do all other shoulder and elbow pathology, including rotator cuffs and some shoulder instability, and then elbow arthroplasty and some elbow instability as well. I do not go to children's, but I'm at the main university campus here down in Salt Lake City, and then I also do 2 days a week in Farmington, which is a satellite campus up north.
Thanks, Chris. So for my practice, it's basically developed into 50% arthroplasty and 50% arthroscopy. Most of the arthroplasty is a combination of both revision and primary. Probably 30% or so of it is revision surgery and 70% of it is primary. And I think if you came here, you'll be able to see a wide variety of procedures from an arthroplasty standpoint, everything from bone loss procedures on the glenoid and humerus and failed implants of a variety of type. We basically do everything soup to nuts, top to bottom from arthroplasty standpoint. We also, Peter didn't mention this in his, but we also will do, Peter has experience doing subscapular sparing shoulder arthroplasty as well. So I think that'll be a unique asset to the trainees as they actually come here to learn. From a arthroscopy soft tissue standpoint, I will do bread and butter rotator cuff and instability, but then I'll go all the way to the extent of tendon transfers for a variety of problems and complex post-reconstructive procedures for patients that have failed prior surgical procedures. And from an elbow standpoint, it includes both elbow arthroscopy as well as soft tissue reconstruction, as well as doing somewhere around 5 to 10 replacements a year.
In addition, here at the University of Utah, we're doing a high volume of research. Our research has several different veins or overall areas of interest. Probably the bulk of our work is clinical research. Our clinical research is focused primarily on the shoulder, and we're providing through that research both retrospective and prospective studies. In retrospective studies, we have a large volume of students that are working with us that are helping us to collect data. We have a prospectively collected outcomes database that they can use for that, where a lot of the data is already has already been collected. For our prospective research, we have multiple prospective randomized clinical trials. Our research in that regard has been funded by the NIH and is something that we're continuing to work to try and push the limits of improving care in that regard. In addition to our clinical research, for which we meet kind of every other week to make sure things are moving forward, we also have a large number of collaborations with other members of our department and throughout the university for biomechanical and animal and more basic science work that Bob is going to talk to us about.
Yeah, thanks, Peter. So from a basic science side, we've really been able to develop a unique collaboration with the various scientists within our department. The Department of Orthopedics has 12 basic scientists as part of the research division, and we've been lucky enough to collaborate with several of them. From a biomechanical side, Heath Henninger is a bioengineer that we have collaborated with now over the past 15 years here. He did his training here at Utah and then came to do a postdoc here in the Department of Orthopedics, working specifically on shoulder surgery, and then has specifically developed an interest in robotic shoulder simulator as well as biplane fluoroscopy. And his primary areas of research are to be able to look at kinematics of shoulder and shoulder arthroplasty, and he's currently funded through the NIH to specifically look at that. And then our team has been able to collaborate over the past several years, specifically using Heath's interest in shoulder and our expertise from a clinical standpoint to be able to produce some high-level basic science research on shoulder kinematics. As a fellow that's coming in, we want to get the fellows engaged with both clinical research as well as basic science research, and there's going to be an opportunity to be able to work with Heath in his lab on some of the projects that we are actually currently working on. The other area of basic research has been working in collaboration with Mick Jernick. So Mick is a geneticist that is also in our department, but he trained in the Department of Genetics here at the University of Utah. He was brought on to the department to be able to specifically look at the genetics of osteoarthritis. But we've been lucky enough to be able to have him collaborate with us to look specifically at the genetics of and the biology of rotator cuff tendon healing. Over the course of the past 5 years, we've been able to develop an animal rotator cuff repair model, specifically a mouse model, and most recently we've been able to transition that to also a rat rotator cuff repair model. And we've been currently looking at various applications of that model, specifically at tendon healing and its relationship to hormones and hormone deficiency or application, as well as other various genetic deformities that then will lead to potentially inferior tendon healing after rotator cuff repair. Again, we're happy to be able to get the fellows engaged in that, to be able to learn how to actually perform the surgeries with us, and then potentially even take that model back with them to their own institutions.
Another really awesome resource that we have here that I think is unique to University of Utah is our Surgical Knowledge Integration Lab, or the SKI Lab. It opened in 2020, and it's a state-of-the-art facility actually in the base of our Orthopaedics Center building that has 12 lab stations and then an adjacent conference room with audio and visual capabilities. We can run bigger labs there, which is really nice, and have visiting professors and everything along those lines. But really, from a day-to-day standpoint, we have essentially an unlimited access to cadaveric shoulders and can work on either research there or more commonly just doing cases. So it's not uncommon for the three of us to take our resident or fellow that's on service down there once or twice a month to go through a shoulder arthroplasty or arthroscopy or try out some new procedures. And it's been a really nice asset for training and then also for us growing wise.
I think so that's great. The next area that we'd like to talk about is the advanced shoulder arthroplasty meeting. So this meeting is going to be an opportunity for the fellows to engage in, if while they're here, it happens in January of every other year. On the off years where the fellow, it won't be going on during the fellowship year of the fellow, we're going to give the fellow that we have selected an opportunity to come in and actually come to the course as well. So we want to make sure that it's open to every fellow that we actually select. So if they're here during their fellowship, we'll give them an opportunity to be able to come during their fellowship. But if it's on the off year, then we'll either offer it to them to come during their senior year of their residency or in the following year in their first year of their practice. So the course was started. Now we're about to enter our fourth meeting back in 2019, and the idea was to create a meeting surrounding shoulder arthroplasty. At that time, there was only the para-shoulder course that ran a 3-day course every other year, specifically looking at every aspect of shoulder arthroplasty, and we decided to try to create a meeting using this similar content, but in the United States. And so far, we've been able to have a very successful meeting. From running the course, it's myself, Jay Keener from WashU, and George Athwal from London, Ontario. And the course is dynamic. It's 3 days. There's a day on anatomic arthroplasty, a day on reverse shoulder arthroplasty, a day on revision shoulder arthroplasty. We have over close to 40 faculty. About 30% of them are international faculty. And for the fellow, it gives you a great opportunity to be able to, learn really in depth what your training is over the course of the 12 months, but also have access to some of the world's leaders in shoulder arthroplasty to be able to ask them questions and be able to actually introduce yourself and be able to kind of get involved in the community. It's a very dynamic meeting, and it's low key, so there's a really a good opportunity for the fellows to be able to engage with the faculty, the other people in the audience, and hopefully start to become part of the community. So again, it runs every other year in January, and we will get all of our fellows engaged in the meeting to be able to start participating as well as obviously attending.
Thanks, Bob. I think, as you've seen, we're all very passionate about shoulder and elbow surgery here, and we feel like we've put together a fellowship that will provide you the tools that you need to become, or any shoulder fellow to become a proficient and excellent shoulder and elbow surgeon. If there's any further questions or concerns, you can reach out to us anytime. We also have information on our website, most of the stuff that we've talked about, and some further information. And looking forward to meeting the incoming class we're planning to interview in January, February.